why don't we open it up to the floor for questions to our panel? Let me start, ask Margaret. I remember a few years ago when we sat on one of our annual visits, we talked for, I think, 45 minutes or so about something that you felt was really important to the success, your ability to move through it, and that was the possibility of hope, that it was so important for your care team to always be able to offer that to you.
Yes.
So maybe you could speak to that a little bit.
Well, maybe it was something of a blessing that I was really so naive about so much of this. I mean, as I say, my mother had died of pancreatic cancer, so I knew that it was, a terrible, terrible, deathly disease. In fact, when I first received the phone call, I called up a friend of mine and said, I'm in terrible trouble, and she said, I'll be right there. And when she came over, I said, I actually met her in the car because I had all these workmen all over my house. And I said, I'm going to die. I'm going to die in a few months. And, it was horrible. And as I was working my way through the process, I felt, I remember so well Dr. Hines, how wonderful he was during my surgery, before my surgery, how encouraging the whole team was without being ridiculously happy and positive, but very solid and strong and encouraging. And I do remember the very first time I had my post-op appointment, and I remember exactly what I was wearing and where I was sitting and where everyone was standing when Dr. Hines said to me, I don't know how long you're going to live. And I said, I know you can't know this, but I know this. I know I'm going to be fine. And I really believed that my team believed that too. They couldn't say that because they're doctors. They can't make that kind of statement. They don't know definitively. But I really believed they knew that. And while I didn't have a particularly close relationship with Dr. Isikoff, I felt that he was working as hard as he was because he believed I would survive. And as years went by, and I always see Dr. Hines every year. In fact, at one point I said, I'm pretty much post-op. Is there a point at which I'm supposed to stop coming? And he said, I want you to come for the rest of your life. And I was like, well, I want to come too, So at one point, I guess it was a couple of years ago, Dr. Hines let me know that, and Barbara Clerkin was still with him. I'm so sorry that she's retired because I always love seeing her, but I'm happy for her. And they let me know that they really didn't think I was going to survive. And even at that point, that many years out, it was absolutely shocking to me. And I said, I'm so glad I didn't know that at the time, because I relied on everybody's strength and hope and optimism and love. And I believed, my doctors believed, and that was essential to me. And even that many years later, it actually shocked me. I actually gasped that, really, I thought you thought I would live. So I think it's essential. It's essential to stay optimistic. It's essential to believe because, in fact, you are living. Every day you are living. And it's important to know that. It's important to be in life. It's important not to let the cancer tell you when you're allowed to live your life. And I really relied on my doctors. I had complete faith in my doctors, and I relied on believing that they believed.
I have a question for Kent also. First of all, I want to let you know I will see you in Hopkinton. This will be my 24th year at Boston.
Fantastic. Congratulations.
Thank you. Was there ever a time during the course of your training where the counsel of your doctors ran counter to what you felt was correct in terms of how you wanted to manage your condition?
Let me answer that in two ways. From a medical perspective, I didn't have the medical background to say whether their advice was correct or incorrect, so I yielded 100% to their advice. I know one time my oncologist, he said, we're going to start chemotherapy. I asked a few questions, and he said, so you don't want to start chemotherapy? I said, no, I didn't say that. I wanted more information. So from a medical perspective, I yielded to my doctors and my private nurse 100%, although not always immediately. Okay, it took some time to think through what they were saying, and so I just asked for that time. I said, okay, I understand that. Let's think about that, and I'll get back to you. But 100% of the time, I went exactly with what they recommended. But from an exercise standpoint, my oncologist and my surgeon didn't have any patients like me, none whatsoever. So I did not accept anything about what they said with regard to what I should be doing as far as exercise go, except for the 6-week period following the 2 surgeries. That I listened to 100% because that wasn't the kind of thing I wanted to take a chance on. I didn't want to have to go through that again or any complications. The risk was a hernia. And if you get a hernia as a result of exercise after surgery, they have to go back in for another surgery. And I knew that. I'm smart enough to know I don't want another surgery. So I said, okay, 6 weeks, 6 weeks. But physical exercise-wise, I could tell in the feedback I was getting from my oncologist, they had never had anybody like that whatsoever. They didn't have any marathon runners. But I had some marathon runners in the medical field. One guy run with Dr. Allen, we call him. He's a marathon runner. And I sought his advice over and over and over again to get his thoughts. And one thing he said to me, he says, Phil, no one's ever died from running a marathon. So I said, I consulted with him over and over and over again about how many miles I should be running and what pace each week, and relative to the treatments that I was getting.
The oncologist was always trying to slow Phil down, and the surgeon said, go for it, because if you're a runner and you have good lungs, you'll recover really well from the surgery. And running never spread cancer, so go for it. So really he had those 2 doctors, and he kept pushing himself, so the oncologist finally is converted, and now the oncologist tells Phil how much he exercises each week. But
I'm going to see him. Dr. Schwartz reports to me at what his exercise regime is. So it's a role reversal.
Phil's an engineer by training, so I think most doctors know their worst patients are engineers. And I know as a nurse, when I'm a critical care nurse, and we'd say, oh my God, it's an engineer with an MI, that's the worst combination. But so he was a disbeliever at first because he was so healthy. They had to prove to him that he had cancer. And he did follow the treatment, the conventional treatment, but he kind of went in kicking and screaming. And I really pushed him, and I used all my influence that I have as a nurse to get people to talk to him. And I even had the medical director of the hospital where I work call Phil, and she had a 45-minute conversation with him and said, surgery is your best shot. So he did go along, and I think anybody who, with this disease, you do feel good until it hits you. And depending upon your background and your just knowing other people with the disease, you really have to be coached along the way. The diagnostic treatments are really difficult. It took us months to diagnose it. We were pushing. I really, again, was using all my influence to call people and push tests forward and get second opinions. And so I think that once he finally saw the pancreatic cells under the microscope with the pathologist, he really realized I do have pancreatic cancer. I have to say, in his now 2.5 years, he's kind of had a reversal, and he really he understands the importance of the continuous treatment, and it is become a chronic condition, and the cancer doesn't define him. It's basically a part of his life. He asked me one day, he said, do you think I have cancer? And I said, yes, I think you have cancer, but you're not going to die from it. And I think that's the message for all of you out here. You do have cancer, but you're not going to die from it.
I had 4 days after I was diagnosed with pancreatic cancer, I had the exploratory Whipple. So I had, and then a year later, Dr. Hines did my full Whipple. And my question is, do you have problems with the scarring or any pain? I haven't been running, and when I do try to run, I wear like a spandex type brace. But lately, it's just, I think it's the scarring that's kind of been bothering me. Do you have any problems with the scarring?
Well, you're talking about the cosmetic aspect of the scarring. You know, I pretty much accepted it. There's not much I can do about it. The chevron from the pancreatic surgery is fading.
Or the pain? Do you have any pain?
Okay, the pain part. My abdominal area from here to here has been tight for 2 years. Like, it's tight to the point of like someone is gripping it with their fist, and it's never not been tight. I've got the tightest abs that anybody could ever possibly have. Even my doctor, when he feels them, he goes, "Boy, those are tight." I go, "Yeah, thanks to you." But as far as pain, you know, they're very tight, and they're tight when I run. It takes a while for them to loosen up. The only thing that I've noticed is that occasionally I get a cramp. And it's a cramp when I'm leaning over like this doing something, all of a sudden I'll get a cramp. And I've never had the cramps before the surgery. It's an abdominal cramp in the muscles right here. And I really have to straighten up and twist to get it to go away. But it's very uncomfortable, like if I'm in a, let's just say, movie theater. It's kind of hard to stand up and straighten in a movie theater. But that's the only thing I've ever experienced as far as pain goes.
Exactly a year ago, February, I was diagnosed with pancreatic cancer. Not a very good one, but from what I learned more today. But anyhow, the point is, listening to you all, I got very emotional, but very inspired. And we talked about the sisterhood in the feminist movement, and this is a brotherhood and sisterhood of sharing something that we understand each other and what it is to live with this. But what I liked is that you talked about all your ups and downs, and you feel you're survivors. And it's interesting because I never know how to label myself. Am I a patient? I say I'm a patient instead of saying I'm a survivor. And then I go, patient is that you're patient with the disease. You just take it and you live with that every day, and you enjoy what you do. And I feel that in spite of the fact that it's a difficult, very difficult disease, and you feel very alone in this disease, it's, you feel like you have lost control because it's something inside you and you don't know where it's doing. And what is this pain? What does it mean? What is this feeling I have right now? It's the very unknown. But you inspired me, I have to tell you, and you gave me a lot of courage. And I liked when I was diagnosed, I said, I'm not going to let the disease define me. And I don't run, but I do other things. But anyhow, what it was interesting is that a lot of my friends want to do things for me, and I love it. But I said, no, you're not going to cook for me. I'm going to cook for myself, because that's what gives me pleasure. So it's such an interesting and difficult balance, really, of how we live our lives. And I'm going to say I'm 83 years old. And, you know, you feel when you're in your 80s, you live the wonderful life. And I always said, a life worth living. And you feel, you know, you're in the best place, actually, I have to say. And they say some of the studies that when you reach your 80s, it's the happiest time. You are yourself completely. You don't worry anymore about anything, really. And then this hits you, which is a very interesting experience. But anyhow, I so want to thank you. And I want to thank you, my friend Aggie, for being there for me in many ways, and also for getting to know more about the foundation. I want to thank you for all you're doing for all of us. But primarily, thank you, my brotherhood and sisterhood. Thank you.
I've been a survivor for 25 years. And I just want to congratulate everybody that's on the panel and my peers in the audience. Congratulations to you all for listening to everybody that cares about you and loves you. But I especially want to congratulate the doctors that I'm not familiar with. I kind of wish back in '91 I'd have had something like this, but life is what it is. I think all 5 of these panelists here today, they spoke on my behalf. I experienced everything that all 5 have. I'm also very athletic. I ran marathons for 36 years. Unfortunately for me, I wore out my knee and had to have a knee replacement, and so I had to figure out what I was going to do the rest of my life. When I got diagnosed and went through everything, I did everything in the hospital. I didn't have the good fortune to decide anything. The doctor that operated on me here in Los Angeles had only done 4 surgeries on the pancreas, and so it was a roll of the dice. I couldn't make the decision. My wife made the decision for me. It was islet cell neuroendocrine pancreatic cancer is what I had. So I had everything taken out the first time, the pancreas, the spleen, and the gallbladder. And so I began my journey, is what I call it. I choose to live life every day. You know, there's times, I think people that have pancreatic cancer are very prideful people in a good way because we're usually strong, headstrong, and determined. So we have a lot of humbling experiences on the way. Unfortunately for me, 2 years after the surgery, I had complications. I had to go back a second time. The second time was worse than the first time because I already knew what I was going to have to go through again. So I've had a lot of, experiences like that. But I think for me, people ask me, I don't really talk about it too much. So this has been a place for me where I feel comfortable talking about my life without pancreatic cancer. I choose to call myself an overcomer because I've been, competitive all my life. And there's always been obstacles, in my life, some of them with solutions and some of them without. And so I took that on for myself. But one of the things that I shared here with the foundation a couple of years ago, I believe it was with the young lady Allison, was hope. And for me, I always went around picking people's brain about what their definition of hope was, and everybody has a definition of hope. And I think for me, how I define hope for myself is a confident expectation of something good. So I may have not had a good day today. I'm not having a good day right now. I'm having some issues with my stomach, with digestion, and I think there was a lady here that talked about the post-Whipple back there with the gas and the food. And so, it's been this long where I haven't had any issues like that, but I'm not any younger. I'm 60. And so I know that, the body has taken its toll in that area with digestion and not having a full pancreas, no spleen, and no gallbladder. So I'm grateful for the last panelist that spoke on nutrition. I'm taking that home with me. I feel good coming here, and I really, like I said, I just wanted to congratulate everybody. Support system is the key. You can't do this on your own. And so I'm looking forward to 20 more years. That's where my faith is at, is if I can live to be 80, I'll be very grateful and thankful. So between now and 80, I'm going to continue to work out, continue to challenge myself spiritually, mentally, physically, and socially. So thank you all for listening, and congratulations to you all. Thank you.